If you've experienced chronic low back pain, someone has probably told you that you need to activate your core muscles more, but is this actually accurate? Do those with chronic low back pain actually need to engage their core muscles more? In this video, we'll discuss core muscle activity with various movements, and then also some exercise that can help with chronic low back pain. First, let's take a look at core muscle activity in those with chronic low back pain. In this article here, they looked at core muscle activity in 5 different movements in those with chronic low back pain compared to those without. The muscle activity that was measured in this study were the longissimus, the iliocostalis muscle, and the multifidus muscle. And then the movements that they assessed were picking something off of the ground, setting something back down to the ground, sitting, standing, and then climbing upstairs. And what they found was that core muscle activity was increased with all of the movements in all of the muscles, except for some reason the left multifidus muscle, specifically when bending over to pick something up. For some reason, that one didn't quite reach statistical significance. So what we see in those with chronic low back pain is that they have a protective muscle guarding with normal activities. So the advice that they actually need to engage their core muscles more is something that they're actually already doing, which means that rehab for chronic low back pain should focus on decreasing that protective muscle guarding. Now, there's a ton of different exercises that could be beneficial for chronic low back pain, and the goal of this exercise progression is to expose the spine to some movements without triggering that protective muscle guarding. The first exercise is Cat-camel, and the goal here is just to move the spine into flexion and extension. We're not too concerned about form here. In fact, it's okay if we deviate a little bit because we're just trying to expose the spine to some different movements. Another similar exercise is a quadruped rock, and depending on tolerance, we might start in this quadruped position and then just move down into child's pose and then back. And then as we're able to tolerate that, then we'll actually go into cobra position so that we're moving the spine through a larger range of motion. It's a little bit more challenging than the cat-camel exercise, but just another way to start exposing the spine to a greater range of motion. Different rolling patterns can also be used to start moving the spine without that protective muscle guarding. Start by only using your upper body to roll from your back to your stomach. So you want to look at your hand with your eyes as you roll over onto your stomach, and then reverse the motion here, again leading with the upper body back over to your back. This can also be repeated with our lower body leading. So we'll start with our right leg. We're going to lift up and over, and then slowly roll onto our stomach, and then leading with that leg back over so that we end up back on our back. And these can be challenging to get a hang of, so if you need to, you can use a pillow or a blanket placed under one side to give yourself a little bit of momentum as you're starting to roll. We can then integrate some of these exercises with various movements. For example, we can regress the movement of picking something off of the ground by doing it in either a tall kneeling or a half kneeling position. This decreases the lever, so that way we don't get that protective muscle guarding. So again, what we can do is we can either just go from here and then back up, or if we want to, we can actually bend over to pick it up and then back. The goal here is that we're just doing it in a normal fashion and we're not too concerned about bracing and that we're not getting that full muscle spasm as we're trying to move through this range of motion. This same idea can be applied for the movements of sitting and standing. So we might start in a tall kneeling position, flex our hips so that we're sitting back down on our heels, and then back up to that tall kneeling position. We can add a little bit of variety by adding maybe a reach in here, so we're getting a little bit of torso rotation. Again, the goal is just that we're starting to expose the spine to some movements without that protective muscle guarding. We can also increase this by going up to that tall kneeling position, and then into a half kneeling position, and then back down, and then eventually going from here to that standing position. Once we're in a standing position, we can go through the same steps to expose the spine to some more ranges of motion. So for example, we might start in a split squat position here, bend over just slightly, and then go through some flexion and extension. So essentially we're doing a cat-camel exercise here, and then building into where we're actually just starting to actually flex the spine to bend over to pick something up off the ground. Or we could progress into something like a split squat or a normal squat. And if we're doing these in the gym, then our strategy might be a little bit different when it comes to core bracing. But since we're just moving through these ranges of motion, the actual movements don't require that much core muscle activity, so we shouldn't have to worry about it when just moving through these movements. In summary, those experiencing chronic low back pain tend to have an increased core muscle activity with normal movements. So the emphasis on core bracing might not be beneficial for all these people, since that's actually what they're already doing. Instead, teaching them to move without that protective muscle guarding might be beneficial.